Excellent. You can start.
Okay, we start?
Yes, yes.
Right, okay. Excellencies, distinguished delegates, ladies and gentlemen, I hope you had a pleasant lunch, a lunch that will keep you awake for this session. I call this meeting into order. Let us begin our deliberations on agenda item 4, indicator framework for the monitoring of progress towards the implementation of the Asia and Pacific Ministerial Declaration on Population. Again, this session will feature a panel discussion, followed by an open discussion with members and associate members. I now call upon the Secretary to make a housekeeping announcement. Secretary, you now have the floor.
Distinguished delegates, an evaluation form of this meeting for this particular meeting is on your respective desks, 1 copy per country delegation. We ask you to kindly fill this in before the end of today's session and leave the completed form on your desk to be collected by Secretariat staff after the closing of today's proceedings. Thank you.
I thank you, Madam Secretary. I now have the honor to invite Ms. Sabine Henning, Secretary at the Midterm Review and Chief of Sustainable Demographic Transition Section, Social Development Division at ESCAP, to give a short presentation. Ms. Henning, you now have the floor.
Distinguished delegates, at the 6th Asian and Pacific Population Conference, ministers and representatives of member and associate members of the Economic and Social Commission for Asia and the Pacific adopted the Asian and Pacific Ministerial Declaration on Population and Development. The declaration contains 116 priority actions to ensure the effective implementation of the program of action, the key actions for its further implementations, and the recommendations arising from their subsequent reviews, including the Ministerial Declaration itself. Also in the Ministerial Declaration, governments called for regular monitoring and evaluation to assess progress towards the continuing implementation of the Program of Action of the International Conference on Population and Development and its related follow-up outcomes, as well as the recommendations contained in the Ministerial Declaration. In response to this call, ESCAP and UNFPA invited member states to consider a set of SDG indicators when drafting their national reports for this midterm review. Out of the 25 national reports received, about 10 explicitly made reference to these indicators. The proposed indicator framework is based on a mapping exercise of these 116 priority areas and the SDG indicators. It covers all topics of the priority actions. Member states are invited to consider the list of suggested Sustainable Development Goal-related indicators for future regular monitoring and evaluation of the Asian and Pacific Ministerial Declaration on Population and Development and the Program of Action in the context of moving forward the implementation of the 2030 Agenda for Sustainable Development. In reviewing these or other indicators, you might want to consider data availability. Timeliness of data should be considered to ensure that monitoring can be conducted in a timely and regular manner, and that member states own these indicators and also have the capacity to provide the data. Thank you.
I thank you, Ms. Henning, for that introductory presentation. Excellencies, distinguished delegates, ladies and gentlemen, we now proceed to have the panel discussion, and I call upon the good self of the chair, who will be the moderator for the panel, to please come forward. Thank you.
Thank you. Good afternoon. May I invite the panel members to come and join me? First, Mr. Nofrijal, Principal Secretary, National Family Planning, Coordinating Board, Republic of Indonesia, or BKKBN. I'd also like to invite Mr. Benoit Calasa, Director, Technical Division of UNFPA, to join me here. Mr. John Wilmoth, we already met him yesterday, Director, Population Division, United Nations Department of Economic and Social Affairs, New York. Your name is and finally, but certainly not least, Ms. Neha Chauhan, Senior Technical Advisor, Advocacy and Accountability, IPPF South Asia region. Please take your seats. Excellencies, distinguished delegates, ladies and gentlemen. After two stimulating panel discussions this morning, focusing on key substantive issues related to the themes of the Asian and Pacific Ministerial Declaration, we now turn to a topic which has important technical and conceptual implications for how we measure progress towards the goals we have set for ourselves. As you know, in 2013, there was a widespread recognition of the need to strengthen data and statistics on the key themes identified in the Asian and Pacific Ministerial Declaration. This is because effective policy needs to address the reality of a situation, to understand the problems it faces, and adjust its approaches to respond to emerging realities. Otherwise, money, time, and effort will be wasted and opportunities lost. In the time since the adoption of the Declaration, the impetus of the 2030 Agenda and the Sustainable Development Goals has seen agreement on a very comprehensive set of indicators to measure progress. Meanwhile, in regions across the world, member states have agreed to indicators to measure their respective progress towards the outcomes of their respective regional review conferences. In this spirit, in this panel, we will discuss what existing indicators could be appropriate for measurement of the implementation of the Asian and Pacific Ministerial Declaration. Fortunately, in this regard, we have an information paper before us, prepared by the Secretariat, identifying indicators from the 2030 Agenda for Sustainable Development that are relevant to this declaration. We are also very lucky and very honored to have a distinguished panel with us to discuss topics related to monitoring progress and indicator frameworks. This panel will enable us to reflect on what priorities exist with regards to data and how the proposed indicator framework may support further implementation of the goals of the Asian and Pacific Ministerial Declaration. And this is the document which I hope you all have with you, which can be used as a reference in our discussion. It is ESCAP/APPC/2018/INF/1. I hope you have it. And there's a table of the indicators that was deemed important by during our meeting in 2013, and we are trying to match it with the existing indicators of SDG according to the tier that countries have decided. Let me now turn to the panel. Let me begin with Pak Nofrijal. Please tell us about the experience of Indonesia in monitoring progress in relation to population and development goals. What challenges were there and what has proved effective in overcoming these challenges? Hopefully, we're covering the last 5 years since the Asia-Pacific Ministerial Declaration, but you can go beyond that if that is your experience. Pak Nov?
Thank you very much, Mr. Chairs, Mr. GP, and most of all, thank you for having me in this distinguished session. And I will share with you all Indonesian experience. Indonesia has put in place the monitoring and on population and reproductive health indicators embedded in the services statistic and under the BKKBN, in particular for family planning related indicators, Ministry of Health on sexual reproductive health related indicators, and the Ministry of Home Affairs, in particular on the vital life events, including the population dynamic. In addition, Indonesia has robust regular data collection processes that support monitoring of the progress. Among other things, the census population national or population national census, and the internal inter-censal surveys every 10 years, and the demographic health survey. The country conducted also regular, for example, family health survey, basic health survey, performance and accountability survey on population and family, and the latest was the Women's Life Experience National Survey that provides situation on gender-based violence and the harmful practice. So we also, the last 3 years, we have what we call performance management accountability survey, working together with Johns Hopkins University. So I would say that in terms of source of data, Indonesia has many, could be say maybe too many, source and mechanism for monitoring progress of population and reproductive health outcomes. Apparently, having many sources of data does not always make work easier, especially when different sources of data show different results on the same indicators. Of course, there might be issues in methodologies that will eventually produce different results. But many times the discussion were circling around which data should one use for a particular indicator. As we are getting more and more pressed by the need of having common platform for monitoring country progress, the government come up with agreement of using the Sustainable Development Goals platform in monitoring the progress of the national development, including for population and reproductive health. Indonesian President has issued the Presidential Regulation number 59/2017 on Sustainable Development Goals. This regulation provides outline on SDGs in Indonesia, roadmap, national action plan to guide the implementation by national and local government, and involvement of all parties to achieve the common goals of SDGs. Under Minister of Development Planning, Indonesia has reviewed and mapped the metadata of all Sustainable Development Goals indicators and has mapped what's global and or national metadata indicators are to be applied in countries. Principles in SDGs have been incorporated into the 2015-2019 Medium-Term Development Plan, and therefore has been used as the main reference to the sectoral plan and programs, including monitoring the achievement of the goals through the indicators. We are now in the process of developing the next medium-term development plan for 2020-2024 using the SDGs roadmap as the reference to set the target and strategies. On the global reporting, I think I should be proud of to say the Indonesian is one of the countries that prepare and submit 2017 voluntary national review on SDGs. And of course, the ICPD plus 25 reporting. And the above reports were prepared in more coordinated ways. The established common platform has helped a lot, not only in the use of which data, which indicators, and which source of data to be used, but also clearer distribution of tasks among the stakeholders. As I mentioned earlier, Indonesia has a lot of source of data that in many cases create complication in monitoring the progress. Understanding the need for common agreement on which data and indicator to be used, the government organized what we call a data consensus meeting. Earlier this year, we call it the summit data summit in February 2018, engaging all relevant ministers, stakeholders, experts, academia, and GSO to agree on which data, indicators, and source of data to be used. We do thanks for supporting the data consensus, backed up by UNFPA and Gajah Mada University in Yogyakarta, and also Central Bureau Statistic of Indonesia. We have challenges around indicators which consider as sensitive. For example, indicators 5.3.2 on female genital mutilation is not yet estimated due to unavailability of data. It requires strong commitment by the government to support finally the data collection. Addressing sensitive indicators need to be follow up closely, such as indicator 5.3.2, especially on the availability of the data and regular base to be incorporated in the national budget. For the moment, I think that's all. Moderators, and I back to you.
Thank you, Panof. Apparently, your challenges are in having too much data. I don't know if many countries. Well, I think I also sometimes have that problem. But I know that some countries are also facing challenges on some data that is really not available or still have to be developed. And as a major challenge, you're looking at FGM, for example, which there is really no data. And many countries probably share that experience. Now, to Mr. Wilmoth, John, in preparing for the 25-year ICPD Program of Action Review, and you're looking at it globally, and the future appraisal of the Commission on Population and Development next year, have you identified any indicators at the global level that will allow monitoring of the ICPD Program of Action? I know it's really a huge number of indicators. I forget how many we were monitoring in ICPD. Can you at this time see any common or at the global level, common indicators or important indicators that will tell us, maybe here at the region, whether we're making progress in achieving the program of action?
Well, thank you, Mr. Chair. It's a daunting task, actually, the identification of the SDG indicators that would be considered population-related, because there are 169 targets, 232 some indicators. We went through as an exercise in the population division a couple of years ago. This was when Sabina Henning was still in the population division in New York, and we were working together on reviewing the SDG indicators to identify those that we might call population related. And we found that it was helpful to categorize them at least in 4 categories. There are some, well, just speaking about the targets, there are some targets of the SDGs that they express normative aspirations around demographic processes, around birth, death, and migration especially. And so that's one set. Then there's another set where the indicator, or let's say the target, may affect population processes. So the achievement of the target, of the SDG target, will have some impact on population processes. And then there are other targets that would be affected by population processes. If they develop in a certain way, it will make it easier to achieve that particular target. And then finally, there's a 4th group that are unrelated, that seem to be unrelated to population processes. In that 4th category, I remember identifying 4 out of 169 targets that we could consider not population related. In other words, almost all of the targets could be considered population related in some way, in some aspect, in one of those other 3 categories that I mentioned. So it's, at that point, what's the value of identifying? If they're all population related, then, so what you have to look for is the strength of the linkages between them. You have to do some analysis and think about, well, how close is the relationship between the target? If you achieve the target, how much will it affect population processes? Or population processes, how big are they as an influence in the achievement of the target? And so I think that's what the regions have done implicitly, is they've gone through the objectives of the different outcome documents from 2013 and tried to identify the targets that then would be the indicators that would be most pertinent to the achievement of the objectives from the regional reviews. So we don't have an agreed set at the global level. We don't have an agreed set of indicators at the global level. And what's worse is that we don't really even have a mandate. To do this. The regional commissions, and it varies across the 5, but they had some form of a mandate, most of them at least, to monitor the progress toward the achievement of the outcome that they agreed in 2013. But there was nothing at the global level that was comparable, so we don't have a clear mandate for this work. I know that UNFPA has worked on it very extensively, and I will let Benoit explain what they've been doing, because it's very interesting and I think very useful, but it's always more challenging when there's not a clear mandate to push forward the work. So I think one of my key messages here is that I think it would be helpful if all of the intergovernmental bodies that are involved in these processes would be very clear about what they want. You can call for monitoring, that's one thing, but if you specifically say we want an indicator framework and we want a process to get to that indicator framework, and in that regard it's worth looking at what happened in ECLAC, because ECLAC seems to be the only one of the regional commissions where there's a fairly clear intergovernmental process that has produced an indicator framework. So there was a clear mandate to do that. There was a formation of a working group that involved member states, and also civil society was involved. So it was a very inclusive process. So in some ways that is similar to what's happened at the global level for the SDGs with the IAEG SDGs. I know you all know that acronym. Interagency and Expert Group on Sustainable Development Goal Indicators. That is the body that was formed by the Statistical Commission to oversee the indicator framework. And you know, I think if we're serious about this, we need some kind of process like that for these population-related SDGs at the regional level and at the global level if we want to move this forward. Otherwise, I'm afraid we're going to have a proliferation of indicator frameworks from various people who are trying to do good work, but without a clear mandate and an intergovernmental agreement on what the indicator frameworks are going to be. I'm not sure how much of it's going to stick and really be influential in the way. And it would also help, I think, to have more coordination across the regions on this work so that we could possibly, that could feed into a global framework.
Apparently that means John wants me to segue to Benoit. So Benoit, can I ask you, just for the Asia Pacific, how can the data and analysis strengthen the review and appraisal of our Asian and Pacific Ministerial Declaration and the Program of Action of ICPD? And maybe in doing that, do we need to build capacity in terms of data collection, disaggregation, as a key means of implementing the 2030 agenda? And in what areas related to the population and development indicators is capacity lacking? And what is being done to address this? Now, if ECLAC is moving in a way in a faster pace than the other regions, do we need to build capacity to be able to match or at least move in a way that the other regions are moving? Benoit.
Thank you, GP. I think maybe starting from where John was trying to bring me into the conversation, UNEPA doesn't have also the mandate to have the global framework for ICPD. But from the conversation yesterday, I think if we had to do some crowdsourcing, the world data has been coming often. From the opening remarks, member state declarations. 116 priorities, the Secretariat said, from the Ministerial declaration. So if we don't have data, we cannot show the progress. We cannot bring evidence that we are moving. So it is important to have at least a result framework, or what don't we call it? A monitoring framework, so that we can assess the implementation of the commitments of the different governments. Yesterday it was also said that we need to learn from what is happening, what is working, what is not working. So just for those principles, we need data, and the SDGs 17 has insisted on that. So the principles are around the partnerships and the means of implementation. So I think we need to go from there. ICPD is about well-being. And if it is about well-being, it is also on the principle of leave no one behind. Unless we have the data that can be disaggregated, we cannot call on each other to say, okay, some people are being left behind, or some countries are being left behind. So inequality came as the finding of this review. And for that, your example from Indonesia, we need capacity. Capacity to undertake the analysis. On FGM, as an indicator, it is true that there is no, the methodology is not there. We have been working now to come up with a risk methodology in UNEPA so that we can take the cohort approach to estimate the risk of a girl to be cut in a specific country. So that is something that we are working on. So that type of capacity is important to be shared, and then to have technical capacity in countries and some institutions for ownership of that indicators. So, but my point here is this region will need definitely to come up with a monitoring framework so that we can hold ourselves accountable. Of course, there is need to be aligned with the SDG indicators. But the ICPD aspiration might go beyond what we have in the SDGs. And for that, some additional indicators might be considered. And we could see some areas that are emerging in this region. One is humanitarian. This is an area where the data do not exist, and we need to partner with agencies that are very active in the area. In the UN, we have OCHA, we have UNHCR, and that can be linked also to IOM when it comes to the migration, which is another feature of this region. So, inequality, humanitarian, and we come to gender. So these are the areas where specific capacity is needed. Census in this region is well advanced when it comes to census. But yet, what we need now is to localize the indicators. It is not enough to have averages, but we need to go to the lower level, to the local government. That is where there is now an area for capacity building which is called small area estimates. So that is also an area for capacity building that we need to look at. And linked to that, we have the all new emerging area of geospatial GIS for localization. So this is also an area where we need to come together and see how innovation. We have countries like China, India, and then with the partnership that we have here with South Korea or Japan, which where we can leverage the IT, intelligence of technology or artificial intelligence to support a new data platform of sharing or access. Aging is an area that the report member state here pointed out. In a region where we have at least 3 demographics, it is very important that we do have the data and the capacity to follow and to differentiate those stages of the demographic transition, and of course to see how we can monitor the social policies that are being put in place to address inequality or risk for vulnerability. So this is also something that I think the region might consider. So there is need for capacity in terms of not only collecting data, but ensuring that the data is being disaggregated, but aligned also to existing framework. Unless there is ownership by countries, I think setting up a monitoring framework will not be useful. And the commitment of member states, but bringing in academia, bringing in civil society organization will be very important to be considered. Let me pause here, then if there is any follow-up, and if there is any interest to learn about the ICPD monitoring framework that UNEPA has developed, and we are using that framework to assess the progress. We undertook 25 time series data analysis based from 1998 indicators. We found 50 indicators where we had 25 years of data, time series. And the findings are quite consistent with what member state national report and the regional review has highlighted. So we are happy to share those findings with you or to discuss further those findings. Thank you.
Thank you, Benoit. So what you're saying is that it is crucial for the region to come up with a monitoring framework that is disaggregated, is aligned to SDG, and is owned by the countries with a regional agreement. And of course, you're pointing out the last one, which is localization. This data needs to be localized because, after all, that is what SDG asks. And of course, there's also the frequency of reporting, no? And the frequency, an annual report. Indonesia has come up with its voluntary report to the UN, no? This year. So those things are crucial, and maybe that's something we need to get in our question and answer later. And now I'd like to ask Ms. Chauhan, from the perspective of CSOs, governments apparently feel there's so much data, but do you still feel that there are still data and statistics that are lacking for these reviews? And in which areas are they lacking? And if we are not reporting on data or statistics that you feel are important, do countries need to build capacity for that? And in order to do that, is there a place for partnerships, collaboration? How can civil society collaborate in the process? As producers, and I know definitely as users of data. Ms. Chauhan.
Thank you, Chair, for this opportunity. The other panel members have already spoken about the importance of the data and the framework. So I'll add it further that it's from a CSO perspective and as an individual, I see it's not just about the monitoring, just the framework. It's not just about data and statistics, what we are talking about. We are here talking about those individuals. How do we ensure that those people whom we are referring to through this data and statistics actually get the services, get the rights, what we are talking about. So if the data, the monitoring around these data, the accountability around that data is not ensured, these frameworks will also be just another round of tables and PDF messages. So I think the biggest target and biggest challenge for us right now is how to make this data work. Because the challenge is not just the data gap, but it is also about how to use this data in the regular planning processes. And when I say planning processes, we are hearing such amazing presentations from most of the countries and the kind of work which is happening, and it's indeed inspiring. But we also need to see that how much of this work is actually moving beyond the capital cities. So when we say using of this data and these statistics, we need that how this data becomes usable for these other setups which are far off from the capital cities, from the rural population, from the disaster-struck situations, and how it happens. I'd also do agree that there is a very strong need of synergies between ICPD and SDGs, and we should be cautious about not creating too much pressure on the system which is already loaded with the need of the data. But at the same time, it is important that we keep in mind that ICPD is a benchmark for when it comes to human rights, dignity, bodily autonomy, gender equality, and addressing disparities which exist. So how do we address the framework in a way that the ICPD is not automatically subsumed within SDGs? We need to keep the focus of what ICPD brings to us, because ICPD in itself is an accountability mechanism for SDGs. Because, while SDGs indicators allow us to track the progress in quantitative data, I think ICPD present us with that scope to go deeper. And let me give you an example. When we see SDGs, we talk about universal health coverage. But ICPD, if the indicators are framed rightly, it also gives us an opportunity to understand that out of that universal health coverage data, how much is out of pocket expenditure, or what is the range of sexual reproductive health services which is included within the universal health coverage. Now, why I'm saying that there is a need for going deeper, despite like all the statements and the kind of progress which we have done within sexual and reproductive health world, there's still 6% of the maternal deaths which are happening due to unsafe abortion. There's still teenage pregnancy happening because the young people didn't get access to comprehensive sexuality education. There are unplanned pregnancy taking place because there was not enough choice of contraceptives. There are school dropouts which are happening because either there are no toilets or there are no sanitary napkins. And there are so many things, and somebody needs to take onus of it. It is happening because somewhere this data which we are talking about is failing us to reach to that end user and to bring their issues to the larger forum. This brings me to my next point, which is this data and statistics, when I say is going, bringing and going to the local end users, it is also about how they know what we are talking about, how they know what data is talking about them, and what is the need. So making it easily comprehensible, because a lot of time it happens that a lot of very important and very right-based laws and policies are introduced. However, they fail, the end user or the local person fail to understand because they are so complicated. So an easier version of these information at the local level. And then you ask about like what are the partnership and collaboration roles which CSOs and others can play. So every time we talk about data and statistics and accountability, a lot of onus lies on data. That remains a central piece. Assuming that our national statistical officers, our institutions for data are aware of all these evolving subjects. So the first recommendation is to involve CSOs and the other agencies for institutionalizing either the capacity building or some kind of regular interface where the commitments which government is making at different forums, such as these ones, are introduced to the statistical offices as well. Plus, this information should be available in a public forum so that individuals or CSOs or any agency, when they want to know that how much the national statistical offices are aware of, what are they trained on, is available. Now, second point of recommendation is that ICPD is not just about health and women issues. It's also about human rights. It's also about financing. And we need those people in the room. We need those institutions in the room. So, so diversifying the engagement around ICPD. And again, let me give an example here that if a woman in a rural place is denied services, so the first person she'll run to and plead will be a doctor. It will never occur to her mind that actually it's a human rights violation and she can actually reach out to these systems which are in place because it's a violation of rights. So how to make that work? Then another concerning point is how more onus remains with the governments and more investment is done on health resources and commodities, because it's concerning that how there is an increasing reliance on private sectors and external funding. So there should be more and more laws which protect the intellectual property rights of medicines and pharmaceuticals and have which kinds of control the out-of-pocket expenditures, which the burden of which is coming to the end users. Now, the second last is that how do we ensure that this is a lot of data-driven discussions, or a lot of mechanisms which you're talking about, if they are not well financed, it is literally impossible to make it work. So ensuring in these, like how the Ministerial Declaration, and the Ministerial Declaration very beautifully outlines, like the section 4 has covered almost all areas that how it can work. So that is there, and but we need effective linkages between national budgets and SRHR issues and these mechanisms to make it work. And final point will be that how also to ensure, like in our drive to get more data, we do not end up further pressurizing the end users, the frontline workers. If you see in most of the countries, the onus of getting this grassroots data finally leads to that one women health worker or a peer worker who's already doing, so almost all government schemes are ending at that one person. How do we ensure that they are not further pressurized? The Ministerial Declaration also have a strong commitment around training the parliamentarians. So if there must be an institutionalized mechanism to ensure, like when the new parliamentarians are on board, the system should ensure them that kind of interaction and awareness about different schemes and different work around the ICPD which we are doing. And my final point is our agreement, which is also mentioned in the Ministerial Declaration about the sub-regional cooperation. So we see a stronger role of the various frames of data which are being used by, let's say, SAARC, ASEAN, to bring them all together and having more cohesive way of bringing different mechanisms without increasing the load. Thank you.
Yes, thank you, Nella. Ms. Chauhan talked really, or asks us to look beyond data and to make the data work. And that means that what does that data represent? Does it represent service delivery? Is it really achieving the goals of ICPD? Do we need to put a lens of ICPD, which is something that has been to go beyond even SDGs, and maybe there are missing areas that we need to look at beyond the SDG. Of course, there's also a concern that this will need financing, any effort at this, and we should avoid putting more onus on governments to do this, particularly frontline health workers. And I'm very familiar with the number of hours health workers have to put in at the village level just to complete the forms or reports. And Indonesia and other countries may be having an overload of data as it's coming around here. So those are the issues that our panel have brought before us. And I would now like to ask the body, delegates, participants, if there's any question you'd like to put to the panel. And I see Japan, the delegate from Japan, and then Tonga.
Thank you, Chair.
And Afghanistan.
Can I start?
Yes.
It is not exactly the question, but about the list which is listed in the document in INF/1. I would like to add two indicators. The first is 3.8.1, coverage of essential health services to measure universal health coverage. I recall 5 years ago, for the adoption of Ministerial Declaration, universal health coverage was one of the pillars of this declaration, so I think that 3.8.1 is quite important. And then the next indicator, it is about 3.4.1, mortality rate attributed to cardiovascular disease, cancer, diabetes, or chronic respiratory disease. Maybe this indicator might have been lost between the health and aging, but this, in the region where aging is the major challenge, this indicator must not be forgotten. So these are my comments. Thank you.
Thank you. I will ask the panel to respond after at least three have asked questions. From Tonga, the delegate from Tonga.
Thank you, Chair. Just like to reiterate what has been said by the panel in terms of the binding that has to be done within the users to utilize the producings of information that has been mandated, especially the new emerging demands of so many indicators, not just the SDGs, but different other frameworks. ICPT is one of them. And we all have our national priorities that has to be effectively respond to these demands. I come from the statistics department, and I think, as we all know, there is a revolutionary shift from focusing on the National Statistics Organization alone to the system as a whole. And it's a comprehensive exercise where we need to know who's doing what and when. And harmonizing the system is another area that a lot of duplication is happening. And these emerging demands has to be effectively merges in a way that we are calling, as I mentioned also yesterday in our report, we also have to investigate in other advanced statistical techniques that have been mentioned also, like the small area estimation. The big call for leaving no one behind is a disaggregation problem. And then if we look at the surveys that we are doing, the minority groups has to be well represented in a sample survey. And often, if you want to report on these minorities, you're going to increase your sample size in order to make sure that they are being included. Increasing your sample size means you have a lot of funds has to be needed. So you need to invest also in those statistical advanced techniques to make sure that you're leaving no one behind. So things about the resources, yes, it's very critical. And looking around, I think to me personally that as long as it is a domestic fund available, then we can be sure that it's going to be sustainable for monitoring. One of the problems with the small island developing states, especially in the Pacific, is that they are all ad hoc data collections. The reason why they are so much reliant on external funding resources, if you can see some of the national undertaking in collections, they are lapsed by so many years. Now with the call for effective monitoring, you have to have a sustainable fund available for these collections. And I think one of the very important points that I'm listening to is that the binding of the users. How are the users going to be utilizing these huge hundreds of indicators that we are going to produce? There has to be a binding, no more aspiration from the side of our users. If they wanted any national collection to be done, there must be a binding towards using those indicators. What sort of policies are going to be changes? What sort of interventions are going to be mobilized? Unless we have confirmation with those, we will see a lot of changes that is happening, not only nationally, but regionally and internationally with all these commitments. Thank you, Chair.
Thank you, Tonga. I can only accept one more intervention from Afghanistan.
Thank you very much. And first of all, I would like to thank all the panelists for their insight on a very important issue that is measuring what we do. Probably a monitoring framework would be required. However, some of the issues that were raised by the panelists, and that was, abundance of indicators, which my delegation agrees to this. The capacities in the governments, especially which are low income and which is undergoing, the protracted conflict. This might be very, very difficult and cumbersome, and therefore, alignment with the SDGs would be required. Let me give you the example of the SDGs. We have 17 goals, but what we do in Afghanistan at the national level, there is a committee led by Ministry of Economy. There we are talking about 16 goals out of the 17 because life under sea is not relevant, to our context. And similarly, there are 169 global targets. For Afghanistan, we have 112. That's what we have been discussing. And out of the 232 indicators, Afghanistan is considering 178. Probably we need to contextualize whatever we are doing. Is it relevant in my situation or not? That's something we need to consider. I also did not hear much on civil registration and vital statistics, which is giving a legal status to those newborns that are born. They will not have a legal status, which is a human right. So therefore, that is something to consider. However, my delegation recommends that the outcome of this review and the regional reports are transmitted and incorporated into 2019 regional review of the 2030 agenda, given the strong links between the Asia-Pacific Ministerial Declaration, International Conference on Population and Development, Program of Action, and the 2030 Agenda for Sustainable Development. Thank you very much.
Thank you, Delegate from Afghanistan. Ken Benoit, endeavor to answer maybe the questions from Tonga and Japan, or any of the questions, yes.
Thank you for the comment. I think it will not be specific responses, but just additional reflection. I think I agree with the delegate from Tonga and from also my colleague panelists here. We need to think investment in data because if this committee is going to adopt a framework, a monitoring framework, the financing resources for that monitoring framework need to be thought about. So we need resources to implement that. I think that is just to respond to the concern. And from Afghanistan, what you are saying is right, but for countries that are post-conflict, we need to think about innovation and how do we use different sources of data from sensors, from satellite images, like it was used in Afghanistan to have those images and then complement. That is now we are talking about hybrid sensors. So that is also an area, an emerging area for capacity that need to be thought about. And for the Japan delegates, you know, we need to be imaginative and flexible when we are asking for indicators and see maybe there's some indicators that can cover for everyone. Definitely, universal health coverage is a must, but for us, for working on sexual and reproductive health and rights, we need to think about the frontline services. How are we reaching to the communities? So primary health care become an entry point for us to go to the universal health coverage and to the SDGs. So I think that is the step-by-step or the pathways that we need to be considering when we are defining indicators and selecting indicators, because we need to prioritize. You cannot take everything, but we need to say, if I take this one, definitely it might lead to the other superior indicators. So that is my reflections.
Thank you, Benoit. John, do you have other thoughts about this? I'm sorry.
Certainly. No, my phone, I'm sorry, my phone rang a little bit, and I'm trying to turn it off. Well, I wanted to pick up on, I could say various things, but this issue of disaggregation, because it keeps coming up, and obviously it is so important and so central to the promise, the pledge to leave, the pledge that no one will be left behind. And yet it's very challenging. I'm afraid there's some wishful thinking out there about the ability to disaggregate all of these indicators by all of these different dimensions. But there's one thing that can be done that is fairly easy and that could have a big payoff, and that is geocoding. And this is a question for Benoit. I mean, to what extent is this being implemented in the 2020 round of censuses in this region, ensuring that everything is geocoded with the censuses, but also other. In other words, if you geocode the data, if you just identify for each observation where it happened, where the person was, then at least you can come up with disaggregation by geography, by place. This is the one that's doable, in my view, is geographic disaggregation. And much inequality is geographically based, and service delivery is geographically based. This is the disaggregation that would be very powerful. And I don't know what's going on in this area. It's not, I mean, Benoit knows much more, But what needs to be done at this point? Do these people need to go to their governments and make sure that this is being handled properly in the 2020 census, for example? I mean, what's the follow-up point on this to ensure that data are being collected with proper geocoding, georeferencing, so that we can at least have a successful disaggregation by geographic place? That's essential.
Yes, do you want to?
The quick answer is that for this region, I think it is happening. I think the first workshop on the countries planning for the census took place, I think, Christophe, well, it was in Cambodia. There was a workshop for the countries preparing for the census, and there is another workshop happening that has happened in South Korea with the support of COSTAT. So we are making sure that all the census, the coming censuses will be georeferences and geocoding. So.
Okay. Panoff, do you want to?
Yes,
yeah.
Thank you, Mr. Chair. So I think we agree on working on the monitoring and evaluation and using a data basis based on one left behind. So I think the delegation for Tonga is, we agree on that. And also, so Indonesia has experience with ad hoc database. So the government should be strong commitment and provide the financial support it, because like Indonesia is geospatial, so there is so many the hard geographies that we should be access on that. So, and also we use the data from the universal health coverage, for like delegation from Japan say, yes, I think to make it report in the SDGs, so we can use the data from the universal health coverage also. Yes, I think the Indonesia, like Indonesia, should be improve the availability of the data. And like I say, this aggregated data, or we can use the latest ICT, information, communication, and technology for the more efficient and economical and speedy data collections. So that's I want to add. Thank you.
Thank you, panel. No more. Yeah. So in closing, what there seems to be a focus on the need for regional frameworks, a regional framework. Of course, we are not here to hammer that out. No, there might be another opportunity for that, and we will take on the recommendation from the panel and the countries themselves in your country reports on this. It's important for us to keep thinking that when we develop the framework, the idea should be on the well-being of our peoples, and towards that end, users, which were brought out here, are essential. And when I say users, I would like to include frontline workers, because they are the ones who actually produce the data. And from the beginning, it should be important and useful to the one who produces the data. Therefore, we will have quality in data coming up the, up the channel. But it's important, as people have said, our panel has said, there is a lot of data. It's how to focus, how to make it useful to the users, and in the end, how does it contribute to well-being? So I'd like to thank the panel, and I'd like to, why don't we give them all a round of applause? Thank you, John, Panoff, Neha, and Benoit. Turning over to the chair.
Pleasure. Thank you very much.
I thank the panelists for their wonderful insights. We now have time to open the floor for additional formal statements from delegates. I kindly request that the statements be exactly 3 minutes long, and they should be within the topic of this roundtable discussion. Deliberations pertaining to other topics can be raised under those respective thematic discussions. In the interest of time again, I ask that you keep your statements brief. The floor is now open for your statements. I invite the first speaker, the distinguished delegate from Cook Islands, to present the Pacific perspective on this regard. And please take the floor.
Mr. Chair, distinguished delegates, on behalf of the 10 Pacific Island countries and territories, I thank you for updating us on the status of monitoring our commitments in the Ministerial Declaration. We take note of and appreciate the proposed set of indicators outlined in the conference paper. We recognize the need for regular monitoring and evaluation of progress towards the implementation of the ICPD Program of Action and its related follow-up outcomes by relevant national authorities. However, we are equally conscious of the range of monitoring requirements placed on national systems which may be under-resourced and lacking capacity. We therefore appreciate efforts to develop a monitoring system which builds on existing internationally and regionally agreed indicators and reporting mechanisms so as to maximize utility and minimize transaction costs. In this respect, UNFPA, in collaboration with SPC, has been supporting Pacific countries to develop a 7-year calendar of large data collection activities in the Pacific, which should result in increased coordination among development agencies. The recent establishment of a regional method boards will also contribute to methodology which is relevant and culturally sensitive to Pacific countries. We recognize that we must continue to build a culture of evidence-based decision-making and advocate for data to be utilized at policy and decision-making level, as well as at the program and service delivery levels. Mr. Chair, we are mindful of the need to continue to strengthen the capacity of national, subnational and local governments to collect, map, analyze and disseminate high-quality data which is disaggregated by income, sex, age, race, ethnicity, migration status, disability, geographic location, and other relevant factors. To achieve this, we recognize the importance of sustainable and cohesive partnership and the continued investment of development partners to improving national population data systems. We look forward to further discussions on a common monitoring framework for assessing progress towards achieving the ICPD Program of Action and Asia and Pacific Ministerial Declaration, and appreciate the work of ESCAP and UNFPA in this regard. I thank you for your attention.
Thank you very much for the distinguished delegates from Cook Islands. The next speaker on the list is the distinguished delegate from Philippines. You may now have the floor.
Thank you, Mr. Chair. The Philippines strongly supports the development of a consensus indicator framework for monitoring the progress towards the implementation of the Asian-Pacific Ministerial Declaration on Population and Development. We commend ESCAP with UNFPA in spearheading the tedious process of developing such very useful framework. In support to that, the government of the Philippines continues to espouse evidence-based actions towards the improvement of sexual and reproductive health among Filipinos, as well as the integration of population dynamics in development initiatives in the country. The country has established and adopted its indicator for the implementation of sustainable development goals. These indicator systems are used to monitor the implementation of the ICPD objectives in the country. Works are also being done towards enhancing the various sources of information and tracking countries' commitment to the ICPD and SDGs through our national surveys, censuses, administrative database, and registry systems. We've just recently conducted our National Demographic and Health Survey and in the process of analyzing the data from our first ever comprehensive National Migration Survey. The Philippines will continue to support regional initiatives towards the promotion of evidence-based implementation of the ICPD and the APMD to leave no one behind. We also look forward to the dissemination of the results of the analysis of the consolidated country assessment of the ICPD implementation and the the documentation of this midterm review as guide for countries to improve their implementing mechanisms for the ICPD. A more regular and frequent collective review of the status of the ICPD and APMD is likewise recommended. A South-South and triangular cooperation can be used for sharing our knowledge and database for evidence-based policy and program development at all levels. Thank you, Mr. Chair.
I thank the distinguished delegate from Philippines. I now invite the distinguished delegate from China to take the floor.
谢谢主席。亚太中长期人口与发展部长级宣言执行进展情况的监测指标框架分为11个方面，全面涵盖了人口与发展的各个领域。现有的指标比较完善，对于指导会员国做好人口与发展工作，促进宣言关键行动的落实，具有重要的指导意义。我们提出1点建议供大会参考。建议进一步细化相关监测指标，增强监测指标的针对性，便于采取有效措施进行干预。促进宣言相关工作目标的实现。例如，对第1项监测指标消除贫困的目标1，消除所有贫困的可持续发展目标的指标 1.1.1。除了贫困人口的姓名、年龄、经济状况和区域外，建议可以增加致贫原因等相关监测指标。根据中国的经验，对于贫困的原因，可以进一步细分为因灾致贫、因病致贫、缺技术、缺劳动力、缺资金等等。近年来，中国政府大力推进脱贫攻坚，取得积极进展。2014年，中国政府在全国范围逐村逐户组织开展贫困识别，基本摸清了贫困人口的分布、致贫原因、脱贫需求等信息，建立贫困人口档案，纳入贫困开发信息系统动态管理，针对性地开展精准扶贫。过去的5年，中国创造了减贫史上的好成绩。全国农村贫困人口从2012年末的9899万人减少到2017年末的3046万人，累计减少6853万人，减贫幅度接近70%。贫困发生率从2012年末的10.2%下降到了2017年底的3.1%，年均脱贫人数1370万人。此外，我们希望并且愿意增强同相关国家和地区在人口发展监测领域的交流合作，共同推动宣言目标的实现。谢谢。
I thank the distinguished delegate from China. I now invite the distinguished delegate from Bangladesh to take the floor.
Honorable Chair, distinguished delegate, respected guest and participant, good afternoon. This is Mizanur Rahman from Bangladesh. In Bangladesh, the first HIV case was detected in 1989. Since then, HIV prevalence remaining less than 0.01% among the general population. Estimated number of people who living with HIV about 13,000, and cumulative identified case 5,586, cumulative death 924, and alive 4,662 among the identified case. Mr. Chair, as per Asia Pacific Regional Framework, HIV/AIDS beyond significant achievement described in Bangladesh context. A total of 6 laws were reviewed and recommendations were sent by the Ministry of Health and Family Welfare to the National Law Commission. A draft Anti-Discriminatory Act has been developed. This process jointly facilitated by AIDS Program, National Human Rights Commission, UN AIDS, and Interministerial Steering Committee. Pillar 2, national stakeholder consultation promote access to affordable medicine, diagnostic, and vaccines. The ARV drugs are provided by the government free of cost since 2012. To increase the case detection, diagnostic facilities were expanded in 23 district government hospitals recently. Situation, about 84% identified HIV enrolled at ART service as August 2018 report. Milestone, expanded HIV testing service in 23 priority districts in the country. Key population program are emphasized the intervention of 23 priority districts for sustainability of the program. Key population coverage is low in the country, yet the needed to be increased. Finally, fast-track strategy of the United Nations 90-90-90 treatment target by 22, end AIDS by 2030. The government of Bangladesh is committed to achieve fast-track strategy that includes 90%, 90%, and 90%. Thank you, sir. Thank you all.
I thank the distinguished delegate from Bangladesh for the statement. I now have the privilege to call upon the distinguished CSO delegate who's going to present to the forum the consolidated CSO statement. You now have the floor.
Honorable Chair, distinguished delegates, government representatives, and fellow advocates. My name is Amita Dhanu, and I'm speaking on behalf of more than 52 CSOs from 24 Asia and the Pacific countries that attended the CSO Preparatory Forum held in advance of the midterm review. A number of constituencies were represented at the forum, including but not limited to women and girls, LGBTIQ people, migrants, young people and adolescents, aging people living with and affected by HIV, people with disabilities, rural people, indigenous and tribal people. True accountability requires robust, transparent, effective, participatory, and well-monitored mechanisms. In the 2013 Asia-Pacific Ministerial Declaration on Population and Development, member states committed towards regular monitoring and evaluation by relevant national authorities of progress towards the continuing implementation of Program of Action of ICPD and its related follow-up outcomes. Recognizing that strong respect for the human rights of all forms the basis of both Agenda 2030 and ICPD Program of Action and the APPC, regional reviews should also draw upon information and recommendations from the UN human rights mechanisms and documents. This eases the reporting burden of states and enhances coherence, efficiency, and accountability. Currently, critical dimensions of sustainable development are either poorly or not measured at all in most countries. This includes issues that affect the most marginalized and vulnerable populations, such as the extent of stigma or discrimination, the quality of education, access to healthcare among adolescents and youth, quality of healthcare itself, and the spatial inequalities. In the absence of a uniform data collection mechanism to capture such qualitative and disaggregated data, planning and addressing the needs of marginalized and vulnerable populations becomes impossible. To achieve this, a rigorous, rights-based and qualitative regional indicator framework for tracking the commitments of 6 APPC beyond Agenda 2030 indicators needs to be developed and implemented. The indicator framework must give effect to the principle of leaving no one behind, especially individuals and groups suffering discrimination. Strengthening national data collection and statistical bodies to collect data disaggregated by sex, age, gender, disabilities, geographical settings, ethnicity, religion, economic, marital, social, and migrant status is a key to these efforts. Along with this, adequate financial and human resources and regular capacity building to enhance collection, analysis, and dissemination of data and statistics is also needed. Regular country progress reports on regional and national commitments translated into local languages and shared through public domain for national dissemination is also critical to a transparent system. And communities from across the region of Asia and the Pacific should be encouraged and empowered to demand the accountability of governments in the implementation of the Asia-Pacific Ministerial Declaration on Population and Development and the ICPD Program of Action. Thank you.
I thank the distinguished delegate from the CSOs of the region for that presentation. With that ending, that brings to a closure the agenda item number 4, and I would just like us to applaud the panelists, the panel discussions, and also the speakers that have presented the statements just before this. That's a very soft one. I'm sure we can have a bigger one. Thank you very much. I now have the honor to invite the chair back to the podium. Thank you.
We now have before us agenda item 3C, population dynamics, vulnerable groups, and resilience to climate change and disasters. We now take up the final agenda item for today, agenda item 3C, and this session will feature a panel discussion, and then there will be time for open discussion with members, associate members, and CSOs. I now have the honor to invite Mr. Mohammed Anwar Hossain, Additional Secretary, Ministry of Finance, Bangladesh, to moderate the discussion. The moderator and distinguished panel members, I invite you to take your seats in the sofa chairs in front of the rostrum.
Thank you, Chair. Excellencies, distinguished delegate, ladies and gentlemen. We now come to our final roundtable after an excellent day, substantive discussion. We now turn to the issue of population dynamics, vulnerable groups, and resilience to climate change and natural disaster. The topic is of urgent relevance. In October, the International Panel on Climate Change released its special report on global warming of 1.5 degrees, highlighting that we are already facing the resilience of climate change and the need of the immediate and comprehensive actions to prevent its impact from being even worse. It is one of the grave injustice of climate change that those who are most likely to face the worst impacts are those least likely to have contributed to the problem in the first place. Those who are the poorest, most marginalized, will feel its impact most keenly. First and foremost, because of their status as the poorest and most marginalized. When looking into ensuring protection of this group, it will be tempting to focus on the previous of the service and development protective infrastructure, and it will be of great importance. However, a key lessons learned from the history of ICPD is that provisions of the service along is not enough to reach our goals. We must focus on the protection of the right of all and the empowerment of the most vulnerable, addressing the root causes of their vulnerability to enable them and adapt to the changing climate. This is the challenge for the next years. We are therefore very lucky and very honored to have distinguished panel with us today to discuss the topic of the repopulation dynamics, vulnerable groups, and resilience to climate change and the national disaster. The panel will enable to reflect on what we've been done in this area and how it can be inform our efforts for going forward. It's my pleasure, it's an honor also to introduce Professor Lakshman Dishanayaka. Professor Lakshman Nayaka is the Vice Chancellor of the University of Colombo. He has a bachelor degree from the University of Colombo, a master degree from Brigi University, Brussels, and PhD from the University and Lilith. He is also the fellow of Royal Society of Arts in the United Kingdom. Prior to the appointment of Vice Chancellor, he served University of Colombo as Senior Professor of the Department of Demography. Then I am introducing Mr. Chinara Aitayeba. Ms. Aitayeba is Director of Public Foundation, Nashbek, based in Bishkek, Kyrgyzstan. She is an expert of multinational finance, transparency, and rural development. Then Nelly Caleb. Nelly Caleb is National Coordinator for the Disability Promotions and Advocacy Association in Vanuatu. Between 2003 and 2007, she worked for the Department of Women Affairs, was the head of the Women with Disabilities Committee, and was the volunteer with DPA. In 2005, Nelly secured the position of the Vice Chair of DPA, then became Assistant Coordinator in 2007, and in 2009 was elected as the National Coordinator, the position she continued hold today. Now, may I request Mr. Professor Lakshman Dishanayaka, can you give an overview of the linkage between climate change and migration?
Thank you.
Is climate change a driver of migration, or can migration means of building resilience against climate change?
Thank you very much. I'll actually use my knowledge on demography and also some of the research that I have done for post-disaster investigative activities. Now, when you look at the climate change action is given in SDG 13, and climate change induced or climate change disaster-induced migration can be related to all other SDGs. Now, when you look at climate change-induced migration, it gives some opportunities also, like new economic activities, the poverty reduction, increased migration and all that, increased wages rather. And also, there are certain challenges that the migrants encounter at places of destination: disrupted social networks, labor exploitation, lack of access to critical services. But also, when you look at the migration aspect of climate change, disaster-induced migration, you can in fact find three types of migration. One is the voluntary migration, and the second is the displaced or forced migration, and also you can find planned relocation. Now, when we look at the process of disaster-induced migration, especially the climate change disaster-induced migration, there is a continuum starting from voluntary migration, and at the other extreme you find the forced migration. So it's a process that you can in fact place all these three aspects in this continuum. But also when you look at the drivers of migration, somebody can actually tell that, okay, the voluntary migration is a climate change induced migration. But also, when you look at the literature, you find that climate change action alone might not actually affect somebody to make a decision to migrate. But that is, you see now, the climate change action is linked up with some other contextual factors like socio-economic factors. So it's interwoven with some other factors for somebody to actually make that movement. And when you have this voluntary migration plus the displacement or the forced migration, you need to, when you look at from the policy perspective, it is better that we adopt differentiated policy framework, because the types of migration that you look at are different in nature. So the same policy framework that you cannot adopt for both types of migration. So that is very important. And also it is very important when you look at the climate change action, climate change disaster-induced migration, it is better that you identify who the vulnerable groups are, who the vulnerable people are. My experience and also the literature suggests that the women and girls, children, disabled people, and the elderly are the most, in fact, vulnerable groups when it comes to displacement or forced migration. And also, now for example, now when you look at the women and girls and the children, the elderly people and disabled people, when the people are displaced because of climate change disaster, then they will be in fact placed in a temporary shelter for a certain period of time. So when they are there, you see now mostly the service provider, those who are supposed to look after these people, will be mainly focusing on the relief delivery system. So they will, I mean, naturally, or they might actually neglect other aspects of our lives. Now, for example, the limited space and also the privacy will not be, privacy will in fact act as constraint. So lack of privacy act as constraint for women and girls, and they will be exposed to all sorts of harassments, including sexual abuse. And also the reproductive health aspects also will be neglected, because the main concentration rather at the initial stage will be mainly focused upon the relief delivery system. So therefore you need to have you need to actually look at all these other factors rather than just concentrating on the relief delivery mechanism. Therefore, you need to actually have very strong protection system in place. And also it is very much important you consult the affected people, because now sometimes the service providers perceive the government or the non-governmental organizations or other actors. They might actually perceive, okay, this is what they really want. But unless you consult and find out what they really want, your delivery system can actually go wrong because you are giving something that they really don't want. Or you are actually doing something wrong to them. So, and also, you see now my experience, plus the literature, what we find is that when the displaced people are going to be in these temporary shelters for a longer period of time, and also, you see now there are 3 R's, relief, rehabilitation, and reconstruction. So when these 3 things are taking place for a very longer period of time, then naturally the displaced people, the affected people might actually develop a kind of dependence syndrome. So therefore you need to in fact have a mechanism, a very, very strategic mechanism, how we can move from relief to development rather than keeping them in a longer period in the temporary shelters. Because you might find in certain locations that, okay, they are even reluctant to move away from these temporary shelters, even if they are given chances to relocate it in other places. And also one of the neglected aspects is the host communities, or where the people will be resettled. You see now the host community or the people who are there already are poorer than the resettled community. So when you actually fully concentrate on the affected people, there can be some social conflicts arising because of your treatment, mainly focusing upon the affected people. So you might actually naturally create certain social conflicts between the 2 communities. And also you can place the climate change-induced migration in the context of population dynamics. It's not just migration alone that can affect, in fact, mortality level of the people, especially the morbidity, the health hazard increase, morbidity and mortality, especially because if the affected community actually carries certain communicable diseases with them into other areas, that also can, in fact, there are certain examples that we can, in fact, similarly the potential fertility, they have high, if they're coming from high fertility areas, that you might actually see that at the place of destination, they might actually they might produce some high fertility clusters. So these are some of the things that, in fact, I can point out when it comes to the general overview of the relationship between climate change and migration. Thank you.
Thank you. Professor Laxman Dishanayaka, you clearly discuss advantages and disadvantages of migration. Mostly disadvantages is much more, and also the classification of migration. We come later on to you. Now I request to Ms. Ayet Bayeba to tell us about climate change will affect Central Asian countries as well. Please, can you explain the impact of Kyrgyzstan, especially the rural area, and the impact of the investment including international donor and migrations, this impact?
Спасибо большое. Я буду говорить на русском. Здравствуйте, уважаемые участники данного мероприятия. Позвольте выразить огромную благодарность организаторам за предоставленную возможность выступить на данной сессии. Я буду выражать свою речь в качестве общественного деятеля. В Кыргызстане около 51% населения составляют мужчины и 49% женщины. Более 66% населения Кыргызстана живут в сельской местности. Общее число занятого населения в Кыргызстане по статистике составляет около 37%. Более 32% трудоспособного населения Кыргызстана во внешней миграции, то есть 32% поставлены на официальный миграционный учет в других странах. Это очень серьезный показатель. Кыргызстан за 27 лет получил финансовую помощь около 10 миллиардов долларов США. Из них около 7 миллиардов – это кредиты, и около 3 миллиардов – это гранты. Бюджет Кыргызстана, к сожалению, очень сильно зависим от внешней помощи. Ежегодный дефицит бюджета и выплаты по долгам не позволяют Кыргызстану поставить на рельсы экономику Кыргызстана. В ближайшие годы наступает пик выплат по долгам. Кыргызстан вынужден покрывать выплаты по долгам через новые внешние заимствования и помощь. Это еще больше утяжеляет ситуацию в Кыргызстане. Если в течение 2 лет не произойдет чудо в Кыргызстане, ситуация будет усугубляться. По поводу изменения климата. Инициативы по изменению климата в Кыргызстане поддерживаются Азиатским банком развития, Всемирным банком, ПРООНом, JICA, Европейским банком реконструкции и развития, продовольственные и сельскохозяйственные организации ООН и несколько других организаций. В Кыргызстане около 98% территории составляют горы. Особенно серьезная ситуация складывается в плане обеспечения водными ресурсами. Предполагается, что в долгосрочной перспективе ввиду повышения поверхностных температур и сокращения площадей ледников, доля ледников в стоках рек будет уменьшаться. Это приведет к повышенной уязвимости для дефицита энергоснабжения, поскольку свыше 90% электроэнергии в стране вырабатывается гидроэлектростанциями. Хотелось бы отметить, что более 20% внешней помощи направлено на сектор энергетики. Снижение водообеспеченности также отрицательно скажется на сельском хозяйстве, главном экономическом секторе Кыргызстана. Внешняя помощь на сельское хозяйство составляет более 12%, включая кредиты и гранты. И около 30% населения в Кыргызстане занято именно в сельском хозяйстве. Глобальная проблема изменения климата является одной из угроз экологической безопасности Кыргызстана. Несмотря на существующие социально-экономические проблемы, Кыргызстан осознает особую важность вопросов охраны окружающей среды и рационального использования природных ресурсов и предпринимает все необходимые меры. Например, в Кыргызстане приняты 7 стратегических документов, касающихся охраны окружающей среды. И хотела привести несколько выводов. Около 45% внешнего долга страны Кыргызстан получил в виде связанной помощи. То есть донор предлагает своих основных подрядчиков и поставщиков преимущественно из своей страны донора. Практически во всех кредитах и грантах около 10% составляют консультационные услуги. То есть, если Кыргызстан получил около 10 миллиардов внешней помощи, около 1 миллиарда долларов США ушли на консультационные услуги. Зачастую рекомендации, которые предлагают зарубежные консультанты, они красивые, но неприменимы для Кыргызстана. Отчеты остаются на полках. Появляется разрыв между развитием регионов, сельских регионов и городов. Увеличивается количество людей, которые уезжают на заработки в другие страны. Если за последние несколько лет ежегодно на заработки уезжали около 4000 человек в год, то вчера депутат парламента Кыргызстана выставил пост на Фейсбуке, где говорится, что в этом году уехали на заработки из Кыргызстана граждане уже более 20 тысяч человек в этом году. В Кыргызстане 58% населения трудоспособного возраста. Из них 65% живут в сельской местности. Поскольку на заработки уезжают люди из сел, то около 35% сельского трудоспособного населения трудится за границей, во внешней миграции. Внешняя помощь неэффективна, не приносит существенного вклада в страну. Коррупция. Так могут сказать около 70% населения в сельских регионах и региональных городах. Индекс доверия граждан Кыргызстана государству составляет около 40%. Информация до сельских регионов не доходит. Красивые отчеты, они объемные и сложны для понимания сельских местных жителей. Поэтому мы предлагаем упрощать все стратегические документы и соглашения. Визуализировать все, что можно визуализировать. Нужны инновационные подходы, чтобы у всех были равные возможности для понимания и стимулирования инициатив и вырабатывалось чувство собственности. Чтобы каждый гражданин чувствовал свою вовлеченность и чувствовал хозяином страны. Кыргызстану очень нужна внешняя помощь, желательно гранты. На реализацию национальных планов, матриц действий, реализацию реформ во всех практически секторах. Доноры часто финансируют на разработку этих документов, а на реализацию оставляют государству. Но из-за дефицита бюджета национальные планы и стратегии реализуются только на 50-60%. Необходимо создать условия, чтобы повышать потенциал всех и представителей госорганов, и членов парламента, и организаций гражданского общества. Благодарю за внимание.
Thank you very much, Ait Bayeva, for your informative discussion regarding your countries. Now we watch a short video clip before the next panelist.
With a disability
and I live in poverty,
my experience in discrimination is compounded.
from road from Kano school in home.
Access to my community is so difficult for me.
Include me inside.
How is it okay to commit rape without punishment?
I have a name. Don't call me by my disability.
We have contributions to make.
Mika, Japanese. My love.
I am an athlete, and through sports, I travel.
I advocate for the rights of people with disability.
Through the business problem, support my community solely respect me. Me from by you think me not strong.
I can live independently.
Me like a sing that all friend long. This problem is not grown out.
I'm a mother and a grandmother, and I'm a boss of my house.
I lead, I advocate, I won't let you stop us. Ensure women and girls with disabilities are included in all development efforts, so no one is left behind.
No one left behind.
Include us.
Include me. Include me.
Okay. Now, Ms. Kelba, can I ask you to say something towards our delegate? Persons with disabilities often represent a particularly marginalized group in disaster responses. Can you explain why this is and what effort have been taken to address these vulnerabilities?
Thank you, Chair. Ladies and gentlemen, as you saw from the video, people with disabilities are often overlooked and marginalized. Their basic rights and freedoms are often denied. I would like to emphasize that the women and girls with disabilities, gender inequalities, reinforces the barriers already experienced and negatively affect the realization of the human rights and access to information and sexual and reproductive health services. In humanitarian situation, the vulnerabilities of women and girls with disabilities are further enhanced. Pacific Islands countries and territories are extremely vulnerable to the adverse effects of climate change and prone to natural disaster. In my country, Vanuatu, I have experienced firsthand the vulnerabilities and the direct adverse effects on women and girls, the elderly, and persons with disabilities. In October 2017, a state of emergency was declared on Ambai Island due to heavy volcano ashfall. 2 people died and 11,000 were evacuated to neighboring islands. A month later, they then had to repatriate to Ambai. In August this year, another state of emergency for Ambai led to another evacuation. The evacuees include people with disabilities. The Vanuatu Disability Promotion and Advocacy Association, in partnership with CPM New Zealand, conducted a needs assessment. The findings show during the evacuation process, adults and children with diverse needs face extreme challenges, particularly those who never travel in their lives. The challenge includes being instructed to leave their wheelchairs and other assistive devices behind, waiting at receiving wharves for extended period of time until they could be transferred to an evacuation center. Many suffered from thirst, hunger, and severe heat due to limited facilities and lack of access to these facilities. These challenges are common to other Pacific countries. At the regional level, the Pacific Disability Forum supports persons with disabilities for better pre- and post-disaster preparedness. The Pacific Disability Inclusive Preparedness and Response is our vision for achieving disability inclusion within preparedness and response efforts throughout the Pacific. This plan is supported by government and civil society partners. I would like to encourage broader partnership and scale-up support to help us achieve our vision. It is important that disaster preparedness plans are inclusive of persons with disabilities and take into account structural gender inequalities which deeply affect women and girls with disabilities. While there has been clear steps towards disability inclusion, disability risk reduction in the Pacific, it is crucial to mainstream this in national, social, and protection policies, and in plans to DRR humanitarian response and recovery. I would like to emphasize that the Convention on the Rights of Persons with Disabilities Article 23 and 25 specifically draw attention to the issues of persons with disabilities in relation to sexual and reproductive health and reproductive rights. Availability and access to sexual and reproductive health services for women and girls with disabilities must be available during normal times, for they will be continually during emergency settings, which ensures that their dignity is safeguarded at all times.
Thank you.
Sorry, the last one.
The last.
As most countries do not have effective regulations and accessibility standards, rebuilding back better in the region does not yet systematically mean it is accessible for people with disabilities and even other vulnerable groups. Considering all this, on behalf of the Pacific Disability Forum, I wish to make 3 recommendations. 1, ensure persons with disabilities and their organizations play an important representative role and are fully consulted during planning, implementation, and follow-up. 2, strengthen national level dialogue between DPOs, NGOs, governments, women's grassroots organizations, and other strategic stakeholders. 3, collect disaggregated data that captured people with disabilities and other vulnerable groups so they are not left behind. In conclusion, in the spirit of leave no one behind, we can only stay true to its meaning if we put our actions to our words. Thank you sincerely for this opportunity, and thank you for your attention.
Thank you, Nelly Clapp, for your very prudent and informative information. You rightly bring the vulnerability groups from the root level, and you mention gender equalities, how affected by the climate change. Now the floor is open for our distinguished delegates. If any ideas you can share, or suggestions, or best practices you can share in this forum. Now the floor is open for the delegate. First, Iran. Delegate, distinguished delegate from Iran.
Thank you very much, sir, and thank you to all the panelists for the very fruitful and useful discussion. I heard that one of the distinguished panelists talked about the neglected aspects of disaster when it relates to the population dimensions. So I'm taking the floor not to ask a question or make a comment, but rather share a story about what happened in Iran exactly about a year ago. We had this major earthquake in western part of Iran, close to the winter. So the situation was very dire. Because we are an earthquake-prone country, people are usually ready to rush in to help. So not only the government, but the people also poured in all these helps to the area. Obviously, the first focus is on the rescue operation, and then what comes in mind is food, shelter, and other basic necessities. So there were so much help into the region that in many areas the problem was how to manage this many help coming in, many equipment, food, stuff, medicine. But just after a few days, they realized that one of the major items that is missing is baby milk bottles. Because, well, many babies, breastfed infants lost their mothers at the earthquake, and they left with the siblings or with the father, but nobody knew how to feed them. At that age, you realize that it's a matter of life and death. So that was a neglected part. That was a lesson learned, that you have to look at things holistically when you want to run a rescue operation. Baby milk bottles, it turned to be a very important item that had been neglected. Also, one of the other items that very soon was realized that is neglected was sanitary pad for the ladies. Just imagine at an area with 700 people dying, 10,000 people injured, and over 70,000 people lost their homes and displaced. And you have people living under tents, under snow, rain, and the ladies are left with no sanitary pads. So these small issues was very important part of taking care of population at the time of the disaster. Thank you very much for the time.
Okay, thank you for sharing the story of Iran. Then India.
Thank you. It was a very, very illuminating and very good panel discussion which we heard. With reference to the point on climate change, we all realize that climate change and management and control of climate change is a shared responsibility of all of us across the world. And it's very important for the countries with low and middle levels of income to be able to manage, a good functional responsibility on this front, while also being able to maintain their standards of living and their energy needs, per capita energy needs, and those kinds of things. So in this context, I would like to mention that sharing of technology, sharing of intellectual know-how, the intellectual property, the know-how, and also on cheap terms, sharing of product so as to manage climate change across national borders is of very high relevance and importance. And we must do the best in this regard, put together, all of us.
Okay. Any distinguished delegates? Delegates from Japan.
Thank you, moderator. I also want to share the case of Japan, as we are also very prone to many disasters, including Great East Japan earthquake, which the tsunami hit in 2011 in the northern east part of Japan. And then during the time, also the municipality office, City Hall was also flown away, and then we have lost many of the records. And then also it was a difficult task to identify the number of deaths and injured and so on and so forth. And also at the time we have found that the death rate for the persons with a disability was 1.9%, twice as high as the total mortality rate of 1.1%. So, but this statistics is given after the disaster, and then by the media, the reporters, they have visited house to house and then asked for the disability status of the victims. But still, I want to stress the needs for the importance of statistics, even for the disasters and for the persons with vulnerable situations. So this is my comments.
Thank you very much. Then Maldives, distinguished delegate from Maldives.
Thank you, Chair. Actually, I would also like to just echo on what has been said by Japan on the importance of data on disasters and climate issues, because for a country like Maldives, where we have so many islands where people are living in very low-lying countries, we had also this experience during the 2004 tsunami, where we had like a lot of islands were destroyed, and like even 40% of our GDP, even like that level of damage was caused. And it took a long time for people to be kept in these like temporary shelters. So like, and the importance of data on like the resident population at the island level, that was something that was felt very important, because we have this keeping of registers that are at the island level, but there are many people who are not registered, who are living in the like other islands, like migrants. So I think the importance of data and also the climate change related SDG goals, still many of these are in the tier 3 indicators, so we need a lot of technology and support in this advancement of this area. Thank you.
At first we respond some questions, then we go the next delegate. Okay.
Thank you very much. I also share some of the experience that all of you had, all the comments that were made. In fact, that is why I said in my presentation, it is very important, like what the distinguished delegate from Iran said, it's very important to consult people at the ground level. Because sometimes when something happens, a disaster happens, people panic. You just go and help, and also you receive all sorts of things. But sometimes the most important things are missing. So that is why we really want to find out what these people really want. So you need to consult them. I had a very good experience during the post-tsunami time in Sri Lanka. I was invited by the UNDP and the Human Rights Commission. I led the team. We consulted, because there was a blame, in fact, because a lot of things are coming in, but we don't know whether that is what the people wanted, the affected people wanted. So I had to consult, together with my colleagues, the 1,142 villages, affected villages in 13 districts. And then we found out actually, some of the things coming in are not that, necessary. There are certain other important things that you need to give them. So that is very important. People consultation on relief, rehabilitation and reconstruction. You need to bring cultural aspects also. It has to be contextualized. Because sometimes you build a house for the affected people, but you see now in our culture, building a house has lots of other things, rituals, the auspicious things, number of windows, number of doors. There are so many things, and that can actually lead to so many other health hazards. They start natural thinking about all these things. You need to bring all these things and contextualize. I fully endorse what the Maldives and also the Japanese delegates said. We need, in fact, scientifically proven data. And that is why we need immediately after a disaster, we need to look at, even sometimes it has to be a process to find out. You need to actually have some recovery impact assessment, whether everybody has recovered. Now, whether we have left anybody behind, you see. Because, you need to make 100% sure everybody was accommodated in your relief, rehabilitation, and reconstruction strategy. I fully agree with the Indian distinguished delegate, because you need to have this, you need to use the technology and the other know-how to prevent disasters happening. Right, sometimes you can't prevent disaster; it suddenly comes. Right, not the climate-induced disaster. Sometimes you get natural disasters which cannot be prevented. So you need to look for various mechanisms to prevent if that is preventable. Otherwise, you have to have, like my colleague here said. We have to have pre and post preparedness strategies. Thank you.
Thank you. Our learned panelist, he told a lot in terms of pre-preparation regarding disaster. Climate change occur natural disaster, and we have to take preparation for resilience against the climate change. Now I request distinguished delegate, Afghanistan.
Thank you very much, Mr. Moderator. And I also thank all the panelists for the comprehensive presentation. My focus is on the Madam Neele Caleb, who talked about disabled persons. So Afghanistan ratified a convention on disabled person in 2012. And then, unfortunately, because of the long conflict, it started with the Soviet aggression, former Soviet aggression, and then continued with different international terrorist groups and so on. So my country, unfortunately, has more than 1.5 million disabled persons. So the question is, what will be the recommendation of the panelists on how to protect them, they be not treated or considered as a burden on society or their social protection, or how they can be given some technical skills so they be self-reliant and not feel burden on the society. Thank you.
Thank you very much, colleague from Armenia. We all knew that the UN has adopted the Convention on the Rights of Persons with Disabilities in 2006, and most countries have ratified the convention. And with the social protection, some of the Pacific countries are taking steps, like they have their own social welfares that applies to all people and also people with disabilities. But some are still to do that. But for us in Vanuatu, what was a good practice there is we have an organization called Vanuatu Skills Partnership. That's when the partner, like the funding comes from DFAT. Thank you, DFAT, for that. And also partner with the government to build the capacities on the economic empowerment of people with disabilities and also people without disabilities. We could see the empowerment, or we could see the good results that comes out from this project. And our people in the rural areas are really coming out. And as we all knew, that there's so many barriers that people with disabilities are facing in the communities. And the main one is the attitudinal barriers. So with this economic empowerment skills training, you could see them coming out selling their products, even though our organization cannot reach them because of the cost of geography, the issue of geographical locations. Our islands were scattered. But otherwise, I believe that I've answered your question. Thank you.
Thank you. Disabled and elderly persons should get preference in every space, every sector of their lives. Rightly you mentioned. Now I invite distinguished delegate from Nepal to say something.
Thank you very much, moderator, and excellent deliberation of the panelists. As we all know, disaster impacts gender and differently able people very differently and very immensely and intensely. It's all over the world. In order to address this, what sort of mechanism, gender and disaster responsive mechanism is made in place at all levels? Because disaster is a phenomenon almost all countries, and particularly in a country like Nepal, very much disaster prone. In Nepal, when earthquake in 2015 hit or earthquake in Nepal, many women died more than men, and also the differently able people also. So, and we have the National Reconstruction Academy was formed, and in that academy, so there was a clause mentioned, gender, in order to make it gender responsive, in every meeting, we need to discuss about the gender and disability issue. So as a way of responding in DRR process. So I'm wondering, Nelly, so what sort of mechanism already in place, not only in your country, in this region, in order to ensure gender responsiveness, at the same time disability people responsive in all disaster relief, rehabilitation, and even the preparedness. Thank you so much.
Thank you, Madam. I think I'll share our experience in Vanuatu. In Vanuatu, we have different clusters, but we have also the gender and protection cluster, which is very active in Vanuatu. And they meet nearly every month, but when there's times of emergency, we meet nearly every day. But what we did is we have to make sure that women are represented in any activities during or before, during, and after any disaster. And representation in all programs on disaster is really important about ensuring people with disabilities and also women are included, because that's the only way that only way to go. For us, for people with disabilities, there's a slogan which says, "Nothing about us without us." So that's why I wish to thank my government that they are recognizing the importance of the inclusion, disability inclusion in our country, and we are really taking part actively in not only in the office but also outside. We are included in different assessment, rapid assessment, other assessments. We also actively participate with the evacuees, which I talked about in the presentation, that they have been evacuated to other islands. So where my office is, majority of these evacuees are living in there, and also the vulnerable groups. So my organization is really actively participate to make sure that the vulnerable groups and also people with disabilities needs and rights are fulfilled. Thank you.
I think no more queries. Okay. Yeah.
Sorry for coming again. One thing is about participation, but another thing is, need of differently able people, and especially of gender, it's different, especially when it comes to SRHR needs. Up till now, I think in many of the countries, the relief package that doesn't include SRHR package in the general relief package or menstrual hygiene package. So what sort of recommendations should we be giving in terms of ensuring the needs, the gender-specific need of women and persons with disabilities are addressed right from the beginning of, how should I say, emergency action, relief action?
Okay, thank you. Thank you, we got your point. You mentioned here need-based assessment for the women should be taken at the time of emergency. At the time of disaster, basically children, women and elderly people are much more badly affected. in the discussion we understand.
I think in order to accommodate this interest, it is very important mainstreaming gender and disability aspects into national policy, right? So there should be a strong framework for that. And also when it comes to disaster, so you have a national policy which has this component, mainstreaming gender and disability. But at the same time, at the ground level, when you in fact have this disaster management plan, then these aspects have to be embedded specifically, explicitly into your plan. And you need to monitor and evaluate whether this is being done at the ground level. So that is very important. Because you can have a plan, but you need to monitor whether these things are being implemented properly at the ground level. So that is why, finally, you need to have a recovery impact assessment system in place. So then you exactly know whether you have accommodated everybody or whether you have left certain people behind. Thank you.
So thank you. We are at the end of our time. By this discussion, we came to know climate change affect populations group differently. Groups which are already marginalized are more likely to live in the area that impact by disaster and climate change. This group also tend to depend on jobs located within the sector that are affected by the impact of the climate change and disaster, and they have less financial and social capital to recover from the damage of the loss and economic opportunity. Member states have agreed that there are strong linkage between population and climate change, which has been recognized both in the program of action of the International Conference on Population and Development. Also, Asia and Pacific Ministerial Declaration on Population and Development. The resilience of vulnerable groups in the face of climate change and disaster will be increased in population factors are considered, and if voice of this group are heard when planning for the impact of climate change and disaster. So thank you all for patient hearing. Thank you, everybody.
I thank the panelists for their insights and the moderator for facilitating the discussion. A round of applause for them again. We now have time to open the floor for additional formal statements from delegates. I kindly request that your statements refer to the topic of this roundtable discussion and not exceed 3 minutes. In the interest of time again, I ask that you keep your statements brief. The floor is now open for your statements. I invite the first speaker, the distinguished delegate from Kiribati, on behalf of Pacific countries, to take the floor. Kiribati.
Mr. Chair, distinguished panelists, on behalf of the 10 Pacific Island countries and territories, I would like to express our appreciation for the informative remarks. We also extend our thanks to ESCAP and UNFPA for placing a spotlight on this important topic. Climate change is increasing the frequency and intensity of natural disasters in vulnerable Pacific Island countries, which is contributing to population displacement and negatively affecting our efforts to reduce poverty and inequality. In 2015, the Pacific Islands adopted the Kaila Declaration, which outlines important measures to strengthen climate change resilience through realizing sexual and reproductive health and rights, and improving maternal, newborn, child, and adolescent health. In the context of the Kaila and Ministerial declarations, we emphasize the need for Pacific voices in global conversations to share our diverse experiences in climate change risks and resilience, which may benefit others while ensuring that our specific needs are addressed. Mr. Chair, central to the Kaila Declaration is a recognition that climate affects everyone. However, women, children, and young people are disproportionately affected. We therefore highlighted the importance of engaging civil society, women, youth, older persons, and persons with disabilities as equal partners in all efforts towards building climate change resilience, including the prevention and response to gender-based violence. Our call for action includes the following points, which we believe align well with the comments made by panelists today and the Ministerial Declaration currently under review. Focus efforts towards ensuring that women and girls are able to exercise their right to be agents and beneficiaries of climate change action through full participation in shaping these actions and responses. Collect data disaggregated by income, sex, age, race, ethnicity, migration status, disability, geographic location, and other relevant factors in relation to climate change and the impact on the health of women, children, and adolescents, and ensure that this data is utilized in vulnerability and adaptation measure assessments. Strengthen intervention in support of and protection for women and girls, including enhancing access to education and comprehensive mechanisms for ensuring their access to sexual and reproductive health information and services. Strengthen services for the delivery of health care and the urgent deployment of humanitarian and relief supplies for reproductive, maternal, newborn, adolescent, and child health during emergencies, particularly to vulnerable populations living in outer islands and difficult-to-reach areas. Prioritize couples and individuals' access to contraception and information so as to enable free and informed decisions about the number and timing of children, thereby preventing unintended and unplanned pregnancies and reducing the need for abortions. As part of the way forward, clearly spelled out by panelists, we would like to underscore the role that our cultural and traditional knowledge and practices can play in coming up with homegrown solutions to help address some of the remaining challenges of the ICPD in line with the Kaila Declaration. Mr. Chair, in conclusion, we are on the front line of climate change impacts, and we therefore reaffirm our commitment to the ICPD Program of Action and the 2013 Ministerial Declaration, which recognizes the importance of environmental factors in shaping population dynamics, development, and individual well-being. I thank you, Mr. Chair.
Thank you very much, distinguished delegate of Kiribati, on behalf of the Pacific countries. I now invite the next speaker, the distinguished delegate from the Philippines, to take the floor.
Thank you, Mr. Chair. My courtesies to His Excellencies, the delegates, ladies and gentlemen. Assalamualaikum warahmatullahi ta'ala wa barakatuh. Greetings of peace and prosperity to everyone. The Philippines is highly exposed to natural hazards and disasters because it lies along the belt, the Pacific Typhoon Belt, and is within the Pacific Ring of Fire. Its vulnerability is exacerbated by unmanaged settlement in hazard-prone areas, high poverty rate, unplanned urbanization, and land use, as well as degradation of forests and coastal resources, among others. On average, 8 or 9 tropical storms make landfall in the Philippines each year, with another 10 entering the Philippine waters. The brunt of these natural hazards is almost felt by 27.6 million Filipinos who are among the poorest and the marginalized, who also have large family size. They are often trapped in seemingly never-ending cycle of disaster, displacement, and rebuilding. Given its vulnerability to disasters and to the impact of climate change, the challenge to ensure the resiliency of every Filipino family is indeed daunting. But as united people, Filipinos continue to institute measures to build individual communal resiliency. We have a climate change law and aims to institute mechanisms to enhance resiliency of communities to natural disasters. This is supported by the People's Survival Fund that financially supports the implementation of these measures. We are likewise promoting the population health and environment integrated approach to ensure a more holistic approach to addressing population dynamics, environmental, and health issues. Since the natural disasters and climate change is a global phenomenon, a collective approach is imperative. We call the countries in Asia and the Pacific to continue working together and collaborate with each other to build the resiliency of our constituents in the region. The Philippines will always welcome collaborative and coordinating mechanisms with our neighboring and development partners to establish a workable arrangement that can help each country to protect itself from negative impact of national disasters and climate change. Thank you very much.
Thank you, distinguished delegate from the Philippines. I now call on the distinguished delegate from the Maldives for the statement. Please take the floor.
Thank you, Chair. Actually, my statement is more on a general note, so is it okay if I say it?
The guidance for this session is that it must refer to the current topic, which is agenda item 3C.
So maybe after this, the continuation of the previous session, I can continue, yeah?
What session would you like to, which session? Is it 3B or 3A?
3B.
It's 3B. Okay.
So,
Madam Delegate, can I ask first for the next 3 speakers, who I presume are going to speak on 3C, to complete their statements, and then we can go back. I think we have a little more time. Thank you, Madam Delegate. Can I now call on the next speaker on the list on this agenda item, the distinguished delegate from Bangladesh? Please take the floor.
Dear Mr. Chair, distinguished delegates, ladies and gentlemen, good afternoon. It's my great pleasure to address on population dynamics, vulnerable groups, and resilience to climate change and disasters. Bangladesh, being a disaster-prone country, has been practicing a next level of disaster risk management, shifting relief to risk management that is currently aligned with the Sendai Framework for Disaster Risk Management, SDGs, and climate change action. On the endeavor towards the Vision 2021, the country has taken initiatives to mainstream disaster risk management through the 7th Five-Year Plan and the Midterm National Development Plan. We have identified the specific role of different ministries to achieve the targets of the Sendai Framework climate change. The National Plan for Disaster Management developed for the period of 2016 to 2020 that incorporates 22 key targets. The pilot initiatives, Employment Generation for the Poorest of the Poor, is implementing its activities with the aim of reducing disaster risk and to contribute to poverty reduction for the poorest and most vulnerable people through employment generation in lean months. It will be further scaled up, drawing off on the following practices like cash for works, vulnerable groups feeding, and test relief are implementing for both risk and poverty reduction. Gratuitous relief as cash, food, and other essentials during and post-disaster response. Continuous and post-disaster rehabilitation and relief. Establishment of emergency health crisis management, and prediction and warning on health concern from vector-borne diseases. In addition, Bangladesh has institutionalized disaster risk reduction knowledge and practices in elementary education, public and private universities, and various public training institutes. The flagship program of the government on evacuation was cited by Japan as best practice in their disaster management white paper in 2015. The paper also recommended other countries that face similar context to follow the practice. To address, Bangladesh enacted the following legal frameworks against disaster: the Disaster Management Act 2012, Disaster Management Policy 2015, National Plan for Disaster Management 2016-2020. Even after implementing the above measures, still there are some challenges to be addressed for Bangladesh. The key challenges are rapid urbanization with the reinforcement of the regulation, internal displacement due to disaster like river embankment erosion, high salinity resulting food insecurity, climate change triggering on hydrological disasters such as flood, cyclone, and drought. Disasters often result in the loss of life and livelihoods of the people, impacting to GDP. In addition, there are few more challenges Bangladesh is experiencing. These are elderly population is increasing in Bangladesh. To address the vulnerabilities of the aging population, government has to face challenges. Even social safety net programs of the government are increasing gradually.
Please begin to wrap up.
Moreover, I especially want to highlight that from Myanmar, Rohingya influx in Bangladesh has created various consequences on the local community as well as for the state. Mr. Chair, to address population dynamics, vulnerable groups, and resilience to climate change and disasters in Bangladesh, more collaboration of strategies for the regional and international supports are needed. Thank you. Thank you for the listening.
Thank you, distinguished delegate of Bangladesh. I now invite the representative of a representative from the CSOs to give a consolidated CSO statement on this agenda item.
Honorable Chair, distinguished delegates, government representatives, and fellow advocates. My name is Matalita Seva, and I'm speaking on behalf of more than 52 CSOs from 24 Asia and the Pacific countries that attended the CSO preparatory forum held in advance of the midterm review. A number of constituencies were represented at the forum, including, but not limited to, women and girls, LGBTIQ people, migrants, young people and adolescents, aging, people living with and affected by HIV, people with disabilities, rural people, indigenous and tribal peoples. In many countries in Asia and the Pacific, there is a trend of increasing conservatism and authoritarianism. We are extremely concerned that the spaces for CSOs, women human rights defenders, and whistleblowers are shrinking. Those who dare to make a stand against injustice and defend human rights are under attack. Increasing restrictions are being placed on CSOs that work on issues such as SRHR. We underscore that a safe and enabling environment in which CSOs are effectively protected and human rights fulfilled is critical to sustainable and equitable development. Honorable Chair, as we know, Asia-Pacific is the most disaster-prone region in the world. Increasingly, extreme climate events disproportionately impact women, girls, and marginalized groups. Yet, sexual and reproductive health and rights is often neglected in the context of climate change and humanitarian responses. We call on governments to ensure that the human rights and SRHR of marginalized and vulnerable groups receive increased attention during the humanitarian response to crisis and post-crisis situations through access to timely, safe, high-quality, gender-sensitive, affordable, and comprehensive information and services. SRHR, including minimum initial service package and prevention and response to GBV, should be integrated into disaster risk management mechanisms at country level. To ensure effective policy making for enhanced disaster preparedness and management, the collection, availability, and use of high-quality data disaggregated by sex, age, gender, disabilities, geographical settings, ethnicity, religion, marital, economic status, migrant, and social status is needed. Where countries can no longer support the lives of people due to adverse changes in their environment resulting from climate change, adaptation should be supported and facilitated with dignity and respect for people's lives. Local and traditional knowledge on mitigation and adaptation should be utilized and promoted. A strong regulatory framework is needed to ensure corporate and government entities are accountable for actions that increase degradation of the environment. Conducting and publishing regular environmental impact assessments should be obligatory, especially in high-risk areas and industries. And stronger regulations and policies are needed to halt global carbon dioxide and greenhouse gas emissions without resorting to geoengineering and other techno fixes. We also express concern that reliance on private sector and external funding allows states to shift the burden and responsibility of universal health care to the private sector. Combined with a lack of regulatory mechanisms, this perpetuates corruption and capitalization of health resources and commodities. Lack of transparent and accountable health financing structures also exacerbates the non-alignment of national policies with resource allocation. Health financing policy frameworks need to be aligned with health priorities, keeping in mind a rights-based perspective to ensure inclusion of the needs of marginalized and vulnerable groups and encourage an enabling environment. We call on member states to ensure engagement of civil society organizations in the development of budgets and to review health budgets regularly based on the finding from need assessments in consultations with CSOs to ensure appropriate resource allocation. Thank you, Mr. Chair.
Thank you. Distinguished representative of the CSOs. I now call on the distinguished representative of the Pacific Disability Forum for a statement.
Thank you, Mr. Chair.
for giving me this opportunity to intervene as a CSO rep on behalf of persons with disabilities in the Pacific. My name is Ipul Powaseo, and I'm a member of the Pacific Disability Forum Board. Mr. Chair, let me begin by reminding all that according to the World Report on Disability 2011, persons with disabilities comprise 15% of the world population, and almost 2/3 live in the Asia-Pacific region, which account for 690 million. While we are here discussing about the dynamics of population and development and the various dimensions of population demographics, and especially being reminded of leaving no one behind and unprecedented population aging, I would like to seek member states' increased attention to mainstreaming disability into all policies discussed here, including those on sexual and reproductive health, poverty alleviation, gender and climate change. We, persons with disabilities, are made unheard, invisible and unaccounted for because we are considered to be culturally unimportant and non-productive. When mainstreaming disability perspective into all relevant policies, I would like to point out several key factors. Demystifying negative stereotypes against persons with disabilities, enhance disability disaggregated statistics to better understand the vicious cycle between poverty and disability and underserved persons with disabilities. Buildings, transportations, information including ICT related to policy discussed here should be accessible for persons with diverse disabilities. Harmonizing all policies discussed at this forum with the spirit and content of the Incheon Strategy and the Convention on the Rights of Persons with Disabilities, the Sustainable Development Goals. I urge all member states present here, including my country, Papua New Guinea, to intensify the efforts to collect and analyze data on persons with disability in the context of the policy discussed here and submit to UN ESCAP Secretariat and in future country reports. Mr. Chair, we, persons with disabilities, should no longer be invisible, unheard, and unaccounted. I urge all member states represented here to take actions on the points stated above. Thank you, Mr. Chair.
Thank you to the distinguished representative of the Pacific Disability Forum. I would now like to invite the distinguished representative of China to take the floor. Yes, China.
Thank you, Chairman. I would like to speak in Chinese. 中国高度重视应对气候变化工作，坚持统筹国内和国际两个大局，采取强有力的政策行动，有效地控制温室气体排放，增强适应气候变化的能力。中国积极参与全球气候治理进程。 特别在巴黎协定的达成、签署和生效的过程中，发挥了积极的作用。我们关注到，人是发展的中心，人口问题和气候变化存在许多内在的联系。气候变化往往带来灾害，影响着清洁空气、安全的饮用水、环境卫生、充足的食物和安全的住所，进而影响着人群的生计。 营养和健康，对妇女、老人、残疾人、移民等的影响尤其严重。中国政府积极推动实施先台减灾框架，防灾、减灾、救灾工作取得了显著的成就，实施了国家综合防灾减灾规划，为减灾行动提供了科技支撑，重点加强了基层减灾能力的建设。 气候变化导致的灾害，往往使人们陷入贫困。中国主张采用综合性、多维度的风险防范的方式来应对减灾和贫困， 近年来，将减灾和贫困相结合，全面推进了扶贫的工作，要求到2020年要解决区域性整体贫困的问题，实现现行标准下的农村贫困人口全部脱贫。中国的扶贫理念是精准扶贫，根据每个人、每个家庭的致贫原因，通过就地发展产业、转移就业、异地扶贫、生态保护脱贫、健全医保制度和纳入低保等6大措施，力争实现全部脱贫。在扶贫中，充分关注女性、老年人、残疾人等群体，保证每个人不会因为性别、年龄、民族、信仰、流动状况等而被落下。正如我的同事刚才介绍的，从2012年年末到2017年年末，中国累计减少了6853万贫困人口，相当于一个泰国的人口总数。在未来的2018年到2020年，中国还将有4000万多的人口脱贫。在气候变化和灾害加剧的背景下，中国将认真考虑大会中提出的建议，进一步加强细化的相关数据的收集和监测，减少不同人群面对气候变化的潜在的脆弱性，以务实的行动来保障人民的福祉。谢谢 ，Thank you.
Thank you, distinguished delegate of China. We have now exhausted our list of speakers on this agenda item. I thank you all for sharing your views. I thank you for sharing your views on this matter. Your insights will be summarized in my summary and report. I now reopen agenda item 2 for the distinguished delegate of Maldives would like to make a statement with on that item. Maldives.
Thank you very much, Chair. We really appreciate this. Excellencies, distinguished delegates, ladies and gentlemen. On behalf of the government of Maldives, my delegation and I would like to convey our government's appreciation to ESCAP and UNFPA for convening this midterm review of the Asia-Pacific Ministerial Declaration on Population and Development. Since the ICPD Program of Action and the APPC Ministerial Declaration, Maldives has achieved much progress in achieving its objectives, mainly in relation to the population development issues that I will highlight here. The life expectancy at birth has increased for both men and women, child survival has improved significantly, and maternal mortality ratio has declined significantly. Infant mortality rate stands at 8 per 1,000 live births, under 5 mortality rate at 9 per 1,000 live births, and maternal mortality ratio at 44 per 100,000 live births in 2016. One of the key factors behind the reduction of maternal and child mortality in the Maldives has been improved access to essential interventions and health services. Family planning, antenatal care, delivery at health facilities, and skilled birth attendance has all increased. National immunization program coverage has been successfully maintained at above 90%. TFR has decreased in the country over the years to an average of 2.46 children in 2014, and it is expected to reach below replacement levels of 1.9 children per woman by 2050. During the period 2010 to 2014, population of the country grew at a rate of 1.67% per annum, and it is projected to further decrease to 0.9% by 2050. The social protection programs in the country provides a range of schemes for the most vulnerable and poor population. Our current Health Master Plan 2016 to 25 enables the implementation of SDGs by aligning these with global and regional health agenda, making progress in terms of universal health coverage. This allows for the improvement of access to needed services, including a robust healthcare workforce that can deliver those services with increased accessibility to affordable medicines in terms of strategies to protect people from impoverishment owing to the health costs. Improving mental and psychosocial health is also in the process with development of national mental health policy and mental health strategy. Maldives is moving from a high burden of communicable diseases towards an increasing burden of non-communicable diseases. In this regard, a multi-sectoral action plan for the prevention and control of NCDs have been developed for 2016 to 2020. The Universal Health Coverage Scheme allows for unlimited coverage of all healthcare services in the country. The National Reproductive Health Strategy works towards strengthening services for providing antenatal care, family planning services. Maldives is committed towards provision of comprehensive sexuality education and universal access to reproductive health for its population. Our country has also achieved universal primary education. The overarching education policy of the government is "No Child Left Behind" reaffirms the government's commitment in ensuring inclusive quality learning opportunities which caters to the needs of every child to reach their full potential. As such, all children are now guaranteed 14 years of free education starting at the age of 4 in pre-primary education till the complete higher secondary education at age 19, which includes 10 years of compulsory cycle from grades 1 to 10. A comprehensive inclusive education policy also ensures and facilitates the education provision for children with disabilities across the nation. The current government that came into effect from November 2018 has a pledge to also provide higher education free up to graduate level. Maldives has made significant progress on gender equality and equity in recent years. This has been reflected in the country's development indicators such as high literacy rate for both men and women, gender parity in enrollment and attainment in primary and secondary education. Women in the country are now more in higher education than men. The enactment of the gender equality law in 2016 marks a milestone in laying a legislative foundation to ensure gender equality in the country. The Ministry of Gender, Family and Child Protection Services, psychosocial support and basic needs to women and girls who are victims of abuse. In addition, a call center and a mobile application was also established in 2017 to facilitate the reporting of violence against children.
Please begin to wrap up.
A high percentage of women in the country now are being appointed in the cabinet, 7 out of 19 ministers being women. Maldives has a retirement pension scheme is funded with contribution from both employees and employers. And we have old age pension schemes providing Maldivian rupiah 5,000 per month as basic pension benefits to ensure financial security for old persons 65 years and over. Poverty and inequality has been brought down, and the female labor force participation in the country is low. Unemployment rate among youth remains a challenge, and creating decent jobs, safe space for youth is of importance and is a priority for the government. With SDGs, majority of the indicators are based on administrative data sources. Strengthening administrative data and to use it for statistical purposes and for evidence-based policy making requires immense support from all sectors involved and is accorded a high priority by the government. Work is underway in developing the national strategy for statistics development till 2030, which incorporates SDG indicators. I would like to take this opportunity to reaffirm the government of Maldives' commitment to the ICPD goals and accord high priority to its implementation. Thank you, Mr. Chair.
Thank you, distinguished delegate of Maldives. As there are no more speakers on any of the agenda items, we are closing all discussion on all the agenda items, and I thank all countries that have given country statements, CSOs, and other participants. It is now 5:04 p.m. We have all earned our rest, particularly our interpreters who are leaving us just now. Let us thank our interpreters. Thank you, they said. I thank the moderators and panelists for sharing their insights. And I thank all country delegates for sharing their views and priorities. These were highly productive sessions. As indicated, I will reflect your insights in my summary, which will be drafted overnight with support from the Secretariat and UNFPA. The Committee on Social Development will open tomorrow morning at 9 in this room. We will resume the midterm review in this same room at 1500 hours or 3 o'clock in the afternoon. I will submit my summary for your review electronically at 12 noon tomorrow. Between 12:15 and 12:30, a few printed copies will be available in this room for those who wish to get copies, hard copies. The chair's summary is a non-negotiated text, but will reflect my views of the meeting. I now invite the Secretary to make relevant announcements.
Excellencies, ladies and gentlemen, thank you for your active engagement in these interactive discussions. We will now explain to you the arrangements for tomorrow afternoon and also starting tomorrow morning. As you may be aware, tomorrow morning is the beginning of the 5th session of the Committee on Social Development. From 12 to 2 p.m. tomorrow, there will be a side event on population development, the role of impact, capital, and innovation, organized by the Ministry of Foreign Affairs of Thailand. The midterm review will recommence at 3 p.m. in this room. Only participants accredited to the midterm review should come to tomorrow afternoon's review meeting. Please be sure to wear your badge, as Secretariat staff will be checking badges on entry to ensure that only those who have registered for the midterm review attend the afternoon session. The meeting report and the chair's summary, as we already heard, will be emailed to you by 12 noon tomorrow to enable you to review the documents before we continue at 3 p.m. A limited number of printed copies of the chair's summary will be available in this room to the delegations accredited to this meeting, and this will be between 12:15 and 12:30. Otherwise, no printed copies will be available, and the chair's summary will only be available in English. We would also like to call on those participants who have not yet completed the survey on carbon emissions to please do so. I would also like to remind you to please complete the evaluation forms that were left on your desks. It should only take a few minutes. Thank you for your attention, and we hope you enjoy your evening in Bangkok. See you tomorrow.
Thank you, Madam Secretary. I wish you all a good evening and a good rest overnight. It is refreshing to have UN meetings and right on time. Thank you again.